Have you ever really stopped to think about why a simple little cut, something that most of us would just slap a Band-Aid on and forget, can become this massive, life-threatening event for someone with diabetes? It's a huge question, and the answer shows us just how deeply this condition can mess with the body's most basic rulebook. All right, let's get into it.
So first off, you got to understand just how big this problem is. That number you're looking at, 25%, that is the lifetime risk that a person with diabetes will develop a foot ulcer. Let that sink in. 1 out of every 4 people. This isn't some rare thing. It's a massive, and I mean massive, public health crisis.
And the stakes? They could not be higher. We're not talking about a simple sore here. A diabetic foot ulcer is the #1 reason for lower limb amputations. And what's truly terrifying? Just look at that quote. The 5-year mortality rate after an amputation can be higher than many types of cancer. It's just devastating.
So yeah, it's a literal crisis underfoot. And to really get why this happens, we have to start with what's supposed to happen. How does the body normally heal itself? Because honestly, it has this incredible system that's pretty close to perfect.
Think of it like the body's own internal repair blueprint. For a healthy person, it's this beautifully choreographed 4-act play, a construction project that just works every single time to fix damaged tissue.
Okay, so here's how it works. Phase 1 is hemostasis. Basically, your platelets rush in, form a clot to stop the bleeding, and they release these things called growth factors that are like the foreman shouting, "All right, let's get to work." Then comes inflammation. This is when the immune system's cleanup crew shows up to clear out all the debris and fight off any nasty bacteria. After that, we hit proliferation. This is the big building phase where new tissue and blood vessels get made. And finally, you've got remodeling, where all that new tissue gets organized and strengthened into a proper scar. It's an amazing, perfectly timed sequence.
So, if the body has this fantastic blueprint, what goes so wrong in diabetes? Well, this is the heart of it. High blood sugar, or hyperglycemia, it comes in like a wrecking ball and just systematically sabotages every single step of that repair process.
So how does it actually break the blueprint? Well, it's not just one single thing. High blood sugar launches this devastating 3-pronged attack on the body's ability to heal itself. All right, saboteur number 1 is endotheliopathy. That's a fancy word for damage to the delicate lining of your blood vessels. Think about it like this. You're trying to build a house, but all the roads leading to the construction site are narrowed and clogged. That's exactly what's happening here. The circulation is so bad, it starves the wound of the oxygen, the nutrients, and all the repair cells it's screaming for.
Next up, saboteur number 2, neuropathy. This is nerve damage, and it's like having a broken security system in your house. A person with diabetes might get a cut, a blister, maybe step on something sharp, and they just don't feel it. So they keep walking on it, day after day, causing more and more trauma, turning a tiny little problem into a massive, deep wound before their brain ever even gets the warning signal.
And the third attacker is immunopathy, basically a weakened immune system. Remember that expert cleanup crew we talked about? Well, now they're confused, they're sluggish, and they're just plain inefficient. Key immune cells can't find the bacteria, and even when they do, they're not great at destroying it. This leaves the wound completely vulnerable, just wide open to dangerous infections that can get out of control fast.
And this chart, wow, it really just lays it all out, doesn't it? On one side, normal healing, robust blood supply, fast immune response, organized growth. Everything is working. And then you look at the diabetic side, and it's all restricted, sluggish, delayed, impaired. Even the growth factors, those critical managers telling the cells what to do, they get trapped and broken down. The whole project just grinds to a halt.
And if you zoom in to the microscopic level, you find these molecular troublemakers. You can think of them as bad code that high blood sugar writes into your body's software. You've got these things called ages that make healthy tissue all stiff and brittle. The communication signals between cells get scrambled. And maybe, worst of all, you get these enzymes that act like a rogue demolition crew, literally tearing down the new tissue faster than the builders can put it up.
Okay, so the situation is pretty grim, I get it, but it is not hopeless, not at all. Medicine has a solid, foundational toolkit for fighting back, and these are the absolute first lines of defense.
These are what we call the 5 pillars of standard care, and it all has to start with getting blood sugar under control. You have to tackle the root cause.
Then, doctors have to surgically remove any dead tissue, get any infection under control with antibiotics, use the right dressings to keep things moist, and, this is so critical, take all the pressure off the wound. You can't heal if you keep injuring it. These are the non-negotiables.
But what happens when all that standard stuff just isn't enough? Well, this is where the science gets really, really cool. This is where we see incredibly innovative new ways to try and fix that broken blueprint.
So one of the more direct approaches is a skin graft. Doctors can literally take a very thin layer of the patient's own healthy skin from somewhere else and transplant it over the wound. It's like patching a hole in a wall. It provides a scaffold and it just kickstarts the body's own healing process again.
And we can take that a step further with tissue-engineered skin. These are incredible lab-grown skin substitutes. The best way to think of them is like a high-tech living bandage. It's not a permanent replacement, but it acts as this temporary layer that's full of signals that basically scream at the patient's own cells to wake up and get back to work.
Now this is a really exciting frontier, using cells derived from bone marrow. We're talking about applying stem cells directly to the wound. It's like bringing in a whole new crew of master builders right to the construction site. Builders who have the potential to regenerate not just the skin, but even the damaged blood vessels underneath. It's amazing stuff.
And finally, there are even physical tools, like something called a vac dressing. A special dressing is sealed over the wound and it's hooked up to a small pump that creates a gentle vacuum. It literally pulls excess fluid out, which reduces swelling, improves blood flow, and physically encourages the cells to grow and build new tissue.
So, look, while high blood sugar is a powerful saboteur of the body's amazing healing blueprint, we are absolutely not defenseless. We're fighting back. The tools are getting smarter and more powerful, and they offer real hope. But you know, with the number of people with diabetes just exploding worldwide, the real question isn't just if science can innovate, it's whether we can innovate fast enough and make these amazing therapies available and accessible to everyone who needs them before it's too late.